United States just talking moments ago. I want to welcome emergency medicine physician Dr. Manish Garg and attorney Andrew Lieb to discuss the latest on vaccine mandates in the world of business. Gentlemen, thank you for joining me this hour. Doctor, I'll begin with you. We heard from President Biden just moments ago on the new plan of attacking to help slow the spread of COVID. What are your thoughts on his plan after he's consulted with many of his doctors in the public health sector there at the White House?
Well, hi, Kelly. Thank you for having me on the show. I think the president gave a very clear message today that the way that we're going to get out of this most recent wave is at a population level and at a health system level. So at the population level, it looks like it's vaccines and it's making sure that we have enough tests. And at the health system level, it's giving reinforcement to very, very tired healthcare workers. As a frontline emergency medicine physician in 3 New York City hospitals, it's been 2 years. And I know from a patient standpoint too, and as a family man, it's been 2 years. And it's been really, really difficult. And I think, it's not Groundhog's Day, but it just feels like it's up again. And I think this was a very clear message that the way out of this is going to be through testing, it's going to be through vaccine and boosting, and it's not going to be through major closures.
Doctor, there's something that you said that's very important. I just want to zero in on. You mentioned that you're a family man, you're a doctor, and you're also someone who just cares about what's going on in this country. Let me switch my focus now to Attorney Lieb. The vaccine mandates, whether coming from the federal level or the local level, can be quite confusing, as you know. Where can employers, however, turn for guidance in times like these to avoid misinformation and disinformation?
Kelly, what a challenge of our day. And I first want to agree with Dr. Garg that this is not just on me as a professional, but in my own life. I'm saying this. I run a law firm and it's a disaster. And the reason it's a disaster is that you have different states with different rules and different cities with different rules and different counties with different rules. But Kelly, we have to start at the top, and President Biden mentioned it. On Friday, the Sixth Circuit Court of Appeals upheld what's called the Emergency Temporary Standard, which is the OSHA vaccine or mask/test requirement. And what employers should start off doing is going to the OSHA website that explains that. But they really need to key in on their states and localities. And there's no substitute for having a house counsel or outside attorney that can help you out get through this. Unfortunately, I think we're at a place where you can no longer just do it in-house unless you're qualified to figure this out. It's just too confusing with too many different requirements.
It is confusing, and as you know, OSHA, which of course is the Occupational Safety and Health Administration, has been empowered to enforce these mandates, but the agency is already overwhelmed and has actually been suspending efforts to check for compliance. So what should business owners be doing right now until the matter is resolved? Or might I add, what should employees be doing?
So let's hit that from two sides, Kelly. First of all, OSHA's put out deadlines. We have till January 10th till they're going to enforce anything. So nothing's getting enforced till January 10th. And at that point, what you have to do is start dealing with the vaccine requirements and the notice requirements. On their website, they tell employers what they have to notice to employees, including updating their policy manuals of what they're going to do. With respect to testing, that doesn't happen till February 9th. But just to set this aside for a second, I don't know that OSHA needs to enforce overall. I think one enforcement will be enough to send shockwaves. Why? Because OSHA's fine is $136,000 plus for a willful violation. Wow. Willful means you knew it and you intentionally disregarded it. That's per a violation. What we have in many states, including my state of New York, where I practice actively, is that there's whistleblower protection, meaning any employee can complain to OSHA if their employer is not doing this, and if that employee has reprimand, they can sue the employer. What's going to happen is employees are going to alert OSHA. OSHA is going to issue this willful violation of $136,000 plus per violation, and that's going to send shockwaves where all employers who otherwise might have disregarded it and not got their own attorney to figure out if their law comports with Texas because Texas has their own stuff, or Florida because they have their own stuff. Those people are going to get right on with it because money talks in the business world.
All right. Dr. Garg, we've got to bring you back in. Look, the Omicron variant is traveling and moving swiftly and rapidly, much to the shock of many Americans. Did you anticipate this when it first hit? And if we are not careful, will we likely see a tsunami wave of more cases?
Yeah, Kelly, I got to tell you, this is, I have to admit that it's come a lot faster than I think we had imagined, but this is something that we've been thinking could happen. It's within the realm. The sad thing is that if you look at the ancestral lineage of this particular virus, it comes from the beta ancestry, which is a couple of years ago. So it's concerning that we're having these variants come out from, blasts from the past. And so, maybe in the future, there may be an alpha variant that comes out. There may be another delta variant that comes out. So I think what's really important for us is to think about what our multi-layered approach is here. So one, right, we know that vaccines are the best strategy that we have. And I don't have any conflicts of interest. I don't have any direct relationships with any of the vaccine companies. I'm an emergency medicine doctor who's seeing what's happening, on the front line. Second, the masks are really an important thing, especially right now. It's cold out. I know people are staying indoors. There's much more transmission happening. This is a very, very highly transmissible variant that's here. So it's really important that we're doing that part of the layered approach. Also the distancing, the hand washing, trying to make sure we're in ventilated spaces as much as we could possibly do. I think these are critically important as we address the pandemic. And in terms of, and I can maybe kind of send this back to Mr. Lieb here, I think that one of the challenges that we've had is we don't want to shut down areas of the economy. We certainly won't want to make these mandates, which are infringing on a lot of people's personal or business rights. I understand that. From a public health standpoint, I think rather than looking at the way we've been doing things in a traffic pattern with roundabouts and just having people go in every direction, right now, while we're at the beginning of this gigantic tsunami, as you mentioned, Kelly, I think it's important that we put the stoplights back in, that we can say, hey, for 2 weeks, we may be able to put this stoplight in, make this, make this intervention X. And if we're able to do that, we as a people can come together, understand that it's going to be for that period of time. And then when we're able to come back, they can feel proud and excited that we're able to make a change, and we can actually flatten the curve so that we don't crumble our healthcare systems.
Dr. Manish Garg, appreciate you, as well as Anthony Lieb, attorney at law. Thank you, gentlemen, very much. Let's put the stoplights out there as well as the